Welcome to What the Health? The podcast where anything health is fair game. There's a lot of garbage advice and misinformation out there that can leave you feeling stumped and stuck. Together, let's sift through the sea of BS and find the best ways to get healthy and stay healthy. Join the team as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan Turo, Angela Turo, and Dr. Riley Brown.
And welcome to another episode of What the Health. I am Dr. Dan here with my co-host today,
Dr. Riley.
Welcome back, everyone. Remember our disclaimer, everything on here is for informational purposes only. Nothing you hear should be intended to diagnose or treat any disease condition. Always consult with your trusted health professional. However, as Dr. Riley and I always tend to do, we're focused very much on chiropractic today, which I would consider us some of the experts, right?
Yeah.
So I've only been doing it 13 years now. So today we're going to talk about kind of the subluxation progression, and really we were going back and forth. Do we call it subluxation progression or chronicity of chiropractic? But one question that I always seem to get, and I'm sure you do a lot too, is do you see kids?
Yeah.
And, so it comes down to like, well, why? People always ask, well, why would you take your kids to a chiropractor? And I think that question is often rooted in the misconception of what chiropractic is. So why don't we clarify? And I'll ask you the question because you got your daughter checked from a very, very young age.
Mm-hmm.
She just celebrated 9 months,
Yep.
right? 9 months old, little Madeline. So why did you decide to check your daughter's spine and get her adjusted? Was she suffering with anything, or was it just?
No, she was feeling, from what I can tell, fine. Typical baby stuff, and crying when she's hungry, crying when she's tired, all that good stuff. But just knowing, and realizing how much the nervous system affects any person at any age, and the impact that it can have on a baby, like the latching for breastfeeding, sleeping, just even like ear infections. I know that was a route I didn't want to have to face. And so making sure she was aligned from, 12 hours after she was born was a big importance for me.
Yeah. Was that when you first checked her?
Yeah, it was probably earlier than that, honestly.
Yeah. Did you have to adjust her?
I just did a little bit of pressure work on right atlas, but
what were you feeling for on there? Because again, a lot of parents, they don't know. Like, so if they take their young infant to a chiropractor, like, again, you see all the crazy videos online, with people like getting their heads ripped and twisted and popped and cracked, and it's ridiculous. Some of the I don't even know the word. Yeah, it's a show, and they're always moving their microphones to make the biggest popping sounds, and it really is a show, right? Yeah. It's entertainment, but it's not what I would consider very specific, analytic, technologically scientific based chiropractic. So what is it, on an infant as young as your daughter? What were you looking for? I know you did bring her into the office and use some of the technology. So what could a parent expect if they brought their child in?
Yeah, for her, it was, straight after birth, and typically the atlas is the most common first subluxation for a person, which is just the very top bone in the neck. That just comes from passing through the, canal, or even during C-section, they still pull the baby out. So for me, just feeling some of that motion restriction, a lot of times the baby will not want to go towards the side or away from the side that's really bothering them. And so just slightly gently moving the head, and then feeling for a little bit of like swelling or just restriction on that right side. I mean, you're only holding pressure, I think they say similar to what you would put on your eye without causing any pain. So it's a very, very light adjustment, and, they're fresh to the world. They haven't had much traumas or anything like that. So it doesn't take much to get that spine back, back in order as well.
Yeah, and so you're feeling for muscle spasm, like you said, restriction, because again, babies are a bag of reflexes. I always say. So it's very easy to start to see where there's asymmetry left or right, especially if mom is trying to breastfeed and they're doing it very easy on one side and it's a lot more difficult on the other side. And you mentioned that junction, right? That the atlas is the first top bone in the neck, but it sits between two very large bones, right? The occiput, which is the base of the skull, which is where your spinal cord comes right off the brain. And then you have C2, which is the largest bone in the cervical spine. So you have atlas, which is a small bone right between there. So if you have forces coming up from the bottom or down from the top, those forces tend to kind of get stuck and go to the atlas because it's the smallest bone. And so that's where it can slip, slide, lock up and cause that muscle spasm, that tension. And again, that because of the close neurological impacts of things like the vagus nerve, which controls and coordinates a lot of the internal organ function, breathing, the respiration, the heart rate, the digestive tone of the musculature in your digestive tract. A lot of symptoms, especially in babies, can come on when that atlas subluxates, which it misaligns and or restricts in a direction. And so what Dr. Riley was just talking about is, being able to palpate and adjust that with the pressure like you would checking your eye. Or I always say, if you're checking for a bruised apple in the grocery store and you just kind of run your thumb along the surface of it, you can feel that thumb dip in, again, without using a whole ton of pressure. So, that very, very gentle pressure can make a huge, huge difference in getting that atlas realigned and unlocked. And then you mentioned nervous system, right? So as a chiropractor, we use the spine as kind of the gateway is a good term, or, the tool to clear out, to fully optimize the nervous system. Yeah. Your nervous system controls and coordinates everything else. So I had a colleague of mine always used to say in school, he's like, look, if the nervous system was primarily found in your thumb, then, chiropractors would be known as thumb doctors, right? Because we're only looking at the spine because of its intimate relationship with the nervous system. Ultimately, we want the nervous system to be freely, optimally communicating, because when it does that, then it functions appropriately. If there's interference in those messages and the communication, that's when you can have a lot of dysfunction going on. So in infants, like you said, you can see reflux, you can see difficulty breastfeeding on one side or another. You can have, colic, you can have restlessness, you can have ear infections, other sort of breathing challenges. So the list goes on and on. So now we only covered the first, really the first couple months of life here. So when we talk about like the chronicity or the progression of subluxation, okay, and again, we use that word a lot. That's the foundation of what chiropractors do. We're looking for subluxation, which is the misalignment, motion restriction of the spine that causes an irritation to the nervous system. So if you have a subluxation that happens at a very, very young age, let's say from the birth process, or let's say that, they get into a funky position while they're sleeping and they're there for, 12 hours and, something kinks up, and then that's left uncorrected. And so now their body continues to develop with that restriction in the spine. Well, that changes the whole biomechanics of the spine, right?
Oh, yeah.
So now, when we're looking for subluxations, we have different stages that we look for subluxations in. And the first stage is what we consider the most chronic stage. And that's the 0 to 13 years of age. Okay. Kind of pre-adolescent, infant through pre-adolescence. Yeah. And it's important because if you have a subluxation, and it does not get corrected in that time frame. And typical subluxations in that time frame, or the atlas, like you mentioned, a lot of times it's the upper back, right where the neck meets the upper back, because you're going from a very mobile neck to a very rigid upper back where the ribs start attaching. So that junction point, when you're going from a lot of motion to more rigid, rigidness tends to be a sticking point biomechanically in the spine. So when kids are running around learning how to walk and then they fall forward and catch themselves on their arms and their arms jut back and their head goes forward, that can cause that subluxation in that, lower neck, upper back area. And then of other areas, like if they're learning how to walk and they fall on their butt, well, now that sacrum, that tailbone gets kinked.
Yep.
And so now if that tailbone gets kinked, and that's the foundation of the entire spine, now you can have these muscles that start to pull and tighten, and the spine then literally grows asymmetrically. Aaron wanted me to get the nice quote in there about the as the twig is bent, so grows the tree.
Yeah.
I messed that quote up one time, and I couldn't remember the second half of it. So the quote is actually quoted as the twig is bent, so grows the tree. I messed it up and couldn't remember the second half of it. So I said, as the twig is bent, just get your kids adjusted. But
both are true.
Both are true, right? So what it comes down to is we're trying to find those areas of subluxation before, or as close to when they happen as possible, yep. Right? So if a kid develops a cavity, you want the dentist to be able to care for and treat that cavity long before it ever causes pain. Yeah. Okay. Because then if it starts causing pain, that's when the tooth has really started degenerating. And it's actually getting down to a nerve level and it's really causing issues. Well, subluxation, especially in that, 0 to 13 years of age, may not cause any pain whatsoever, but the other impacts like muscle spasm, like tissue swelling, and then the asymmetrical growth of the spine can be set in motion. So if it's not taken care of as close to when it happens as possible, then again, you're setting the body up for possible, very asymmetrical alignments. Yeah. And we had that case that came in very recently. What was your experience when you saw that?
That was, it's not, I guess it's not mind blowing, but when you see that, you're like, wow, it just goes to testify, if you get them checked at a young age so the body can't proceed with, those restrictions as normal, because the body's just going to take them and be like, okay, this is how I'm supposed to function. So I'm going to function like that. And so for him seeing, that x-ray come in, his body could have, how old was he again? He was
13.
Yeah.
Or, so not quite. He'll be 13. Yeah, so just shy of 13.
On that cusp of that chronicity that we talk about.
Yeah.
And knowing that he was still going to grow a good bit and that it was already a severe curvature.
Yeah, 20 plus degrees.
Yeah. So, that's just 13 years old and it's already 20. I couldn't imagine how it would have progressed.
Yeah. So this is what happened. We had a patient who is friends with a colleague of ours, and this colleague referred this patient. It was her son. And they were at an orthopedist office because he was having some lower back pain. He was also in recovery for some knee challenges, but the orthopedist office took 2 x-rays confirming a 22 degree scoliosis, which is a sideways curvature. So if you're looking at the spine straight on, the spine starts to curve sideways, which is not what should normally happen. So it was a 22 degree curvature from the lower back into the middle back, the thoracic and lumbar spine. And again, 2 x-rays that confirmed that distortion. Now, not every case of scoliosis will correct as quickly as this case did. But in this case, and this is something that we're actually looking to publish, where you see pelvic distortion, okay, where you literally, the tailbone is rotated and the iliums, basically your hip crest where your leg bones meet the pelvis. If there's distortion there and tilt, then that sets the framework for that lower spine. And if that is able to be corrected, and usually that correction happens in that 0 to 13, that chronic subluxation time frame. If it's corrected then you can see massive improvement with those curvatures. very, very quickly.
Yeah.
And we see this in colleagues who practice this method of analysis with that type of pelvic distortion that is causing the curvature. If you get the pelvic distortion corrected, then you see a massive improvement of the alignment of the spine, because it's like the kink in the chain, right? You reset the kink, you reset, and then everything else follows suit. And that's at the core of what chiropractic, I think, originally was founded on. It's like, find the one area, the one or two primary areas that are locking up the rest of the spine, causing the most interference to the nerve system. When we talk about, the neurological, the nerve muscle response, then if we can get that nerve system cleared out, then the whole spine can realign. And in this case, one adjustment, it was 3 drop adjustments within seconds, on this kid's tailbone. And it went from the 20-degree curvature to 0 in that one adjustment. So much to the point that the mom was trying to go back to her healthcare provider to say, take this diagnosis of scoliosis off of his file, because she was told by other health professionals that can affect his insurance down the road. She's like, I want this. And we had to type up a letter describing why it was, no longer valid. And the orthopedist office would not take it off of his file, because it's like, no, he needs to come back in for other x-rays, because a chiropractor can't fix that.
Yeah.
Well, we have, across multiple offices, we have thousands of cases that, yes, absolutely correct with that pelvic distortion within, 1 or 2 visits.
Yeah.
Now it's like, imagine if, if you went to the orthodontist and he told you like, oh yeah, 2 weeks, you can, we can put braces and, fix those teeth within 2 weeks. Like, every parent would be, no problem at all. We'll do this program. And that's, again, when you're doing this level of correction and you understand that the importance of getting that spine checked in that 0 to 13 year time frame, we can get kids corrected very, very quickly if they are showing any pelvic distortion that really affects the tone of that entire lower spine. So that's why that 0 to 13 timeline is so key, because it's kind of pre-adolescent. If you think about it, the hormones really are just about, and again, it's a guideline, right? Some kids will hit that a little bit earlier, but it's really, you got to think about the time of when they're going to hit that adolescent stage and their hormones start kicking in, to really start hitting those growth spurts. So if you correct a subluxation before the rapid growth spurt sets in, they're going to be much, much better off than if they have the subluxation, that distortion, that tension is there, and now they have that hormone change into their pre-adolescent, adolescent phase, and they're growing into that with that subluxation and that distortion. So that's why we're always so adamant about getting your kids checked, for subluxation. Now, again, you don't just want to go to any chiropractor, right? Certainly, you want to go to one that looks at x-rays, right? If you're not looking at x-rays and seeing that distortion, then you don't necessarily know which side, which direction, how to adjust that spine that has it could be life-saving within a few visits.
I feel like, the x-rays are massive, because imagine he comes in, you're like, oh yeah, he doesn't have the orthopedic x-rays or anything. You lay him down on the table and say his opposite leg was short, that's what a lot of chiropractors just go off. It's like, imagine he has a naturally short leg on that other side, and you're like, oh, okay, well, it must be on that side. And then you further that scoliosis that he has. So it's like, x-rays in that, 5 to 13 age range is crucial for getting the correct care for them.
Absolutely, because you've got to see that, you've got to see the distortion, and again, it's like, you wouldn't want to take it without knowing what to do with it. But x-rays serve a purpose, and the amount of information that you can gain from it and get the correction. We show pre-post x-rays all the time in that age range, right? That that 0 and really, like you said, 5, because they've got to be able to stand up and listen to directions. So usually around that 5-year-old time frame is when we would get that first picture. But if they are showing any distortion in that time frame from between 13 years old, usually within 1 or 2 adjustments, we can see a 70, 80, 90 plus percent correction very, very quickly. So we're going to definitely get that published. But the importance to understand is, if you have kids or grandkids that even if they don't necessarily have any health challenges, or they're having health challenges that you're not necessarily sure where they're coming from, there's a very good chance that if they have a spinal subluxation, that could be impacting their nervous system's ability to function as healthfully as possible. So important in that. And I guess the big thing is, people want to understand, why do we call that phase chronic, right? Because we're looking at it from the perspective of the average person, right? The average person doesn't even start or think about chiropractic care until well into their 30s or 40s, right?
If we're lucky.
Yeah. And again, that's when the aches and the pains and the, I'm feeling the effects of the aging process. That conversation starts coming in. I'm a little more fatigued. I'm, a little slower to get out of bed in the morning. I don't recover as well from my workouts. So all of those conversations start picking up late 20s, 30s, early 40s. And again, it's like, no matter when you start chiropractic care, I mean, it absolutely has the ability to improve your health and well-being. I mean, we have a couple patients in their late 80s, early 90s that, get care, and, they have to come often because they have a lot of degeneration and we like to say, life experience in their spine. But it makes a difference. They function better. They think more clearly. They see more clearly. They're more stable on their feet. They just feel better, when they're well adjusted versus not. So, but the importance of why we call that first phase chronic is because if we're taking a 30-year-old and we assume that they've never had chiropractic care or not necessarily had good chiropractic care, then a lot of those subluxations that they have in their spine developed early before they turned 13. And so they're chronic because they've been around for 2+ decades at that point. So it's the subluxations that have been around the longest period of time. That's why we call them chronic. Now, in the case of that kid that we just talked about, if he is, he's just turning 13, that subluxation may have only been there a year. I know he had some knee injuries in the past couple of years, so that subluxation could have been there only within the last year. So in his case, he was in the chronic phase of subluxation, but we caught it very acutely. And that's why we're able to get it corrected, because the longer you go from the original subluxation, the harder it is to make a correction, because the body starts accepting that distortion as normal. And so that's the importance in that phase. So again, get your kids checked by a chiropractor who's very specific with what they use to analyze, x-rays, some sort of neurological test. We use infrared thermal scanning in the office. A lot of chiropractors will use strength tests or balance tests, or they'll use heart rate variability. Like they're using some sort of neurological measurement to be able to determine how is the body improving with the chiropractic care and the adjustments that they do. So with that being said, once we hit that 13-year mark, what's the next phase then that we look at?
Subacute that we're looking at.
Yeah, so we talk about subacute, and what's that age range?
13 to 25 is the guideline, but variable depending on female or male.
Yeah, and why is that number important?
Well, it's that 25 is where the spine is like officially done growing. All the growth plates are closed, all that. Like that is your height until you get older and that degeneration sets in. But that 20 to 25 range, somewhere in there, is when spinal fusion is, well, not fusion, but the spinal growth is completely done and you're not getting any more, so to speak.
Yeah, so spinal maturity happens at 20 to 25 years of age, depending on, like you said, male or female. Some females are done growing at 16. Some males grow until they're 24, 25. So again, it's a guide range, but typically on average between the age of 13 and 25, somewhere in there, that's where you have a lot of the growth spurts. Can happen anywhere in there. And again, if you if you have a subluxation that happens in that time frame, think of like, your sports injuries. Now they're playing a lot more sports. They're, a little bit more impact and competition, even like with soccer, swimming, you were a swimmer, you're going a lot harder. You're, going into those turns and kicking off, you're pulling harder.
Turning.
You're turning that head to breathe. Things like lacrosse and hockey and football and, basketball, and, even court sports, tennis, so a mom was in the other day and she said her 10-year-old daughter plays a lot of tennis. Well, any one-sided sport, where you're swinging a racket or swinging a golf club or, you're bowling, where you're doing it one-sided, you're setting the tone for asymmetry in the spine because you're developing, stronger musculature on one side versus another. And so that's why, weight training, resistance training is so incredibly important, especially as that spine is developing, and you want to make sure you're doing it very healthfully, getting with a professional, hopefully having a coach that knows what they're doing, in that middle school, high school time frame, because you're setting the foundation, for your body to progress and improve over time. So again, this is where you're going to see different ages at this time frame. You start driving 16. So it's like, you get into those fender benders and maybe have a bit of a whiplash injury, and your spine isn't fully, developed. It's not fully matured. So it's like, it's still growing at that point. And then you introduce that whiplash force, like that can be, a subluxation event that, sets the spine in motion for this tightness, this distortion, and, an abnormal growth. So again, it's a subacute phase because it's a little bit closer. If you're assuming the 30-year-old shows up in our office and has never been under care, it's a little bit more recent of a timeline of a subluxation. It could have been during the growth phase, but again, it's not as acute as after spinal maturity. So again, it's just a different phase that we're looking at. I would say what we're seeing now more. You can speak to the phones and technology. Back before technology, especially like the phones and looking down for, hours on end a day. Before that, you're supposed to develop a very good, healthy curve in the neck when you're looking at the neck from the side. But now when you're looking down like this for, hours on end, and a lot of the kids, they'll curl up on the couch and they'll have their knees up and they'll be bent forward and looking like this, or they'll be reading sometimes in that, in that abnormal position. So now we're not talking about like, okay, the neck developed healthfully, they were in a whiplash or a sports injury and they lost their curve. Now what we're seeing is these subacute subluxations they never developed a good healthy curve in the spine. And that, again, we talk about the chronicity. If that happens and they mature, at 20 to 24, 25 years of age, and they never developed a healthy curve, what does that do for their ability to ever gain full correction and function?
Big time decreased.
Yes. And those are some of the toughest cases that we deal with, especially the, I wouldn't say hypermobile, but the very flexible young females, especially the ones that have not developed that good, healthy curvature. And it's actually their curve and their neck is reversed. And they develop like that, and they're like in their, mid to late 20s, and we see that reversal. That is a subluxation distortion that has really, been set in motion before their spine matured. And it can make it very, very difficult. Now, again, not impossible, but very, very difficult to correct at that point, because their ligaments, their muscles, their tendons have trained and been used to the reversed position of the neck. And so that's where you're getting into the philosophy of orthodontics, where they say, oh, time and repetition, is what helps improve the teeth. Well, if you've got someone in their mid to late 20s, early 30s, and they don't have a curve, and it wasn't from a recent injury, but it was from a subacute subluxation process, it becomes that much harder because their body has accepted it as normal.
Yep.
So that spinal maturity that you mentioned, that time frame, that 20 to 24 years of age, is so important. So if you miss the timeline of the 0 to 13 and you don't get checked pre-adolescent, my goodness, get your adolescence checked. That 13 before spinal maturity, 13 to 20 really, because you want to make sure that that spine is, developing as healthfully as possible. No curves looking straight on, and good healthy curves looking at it from the side. And that is something that can be, the earlier you catch it, the easier it is to make corrections. So that's the timeline. And again, call it subacute because it's a little bit longer than the chronic subluxation 0 to 13. But again, that 13 to 25 time frame is really when the largest amount of growth happens. And you want to make sure that, you've got good alignment and good care in that time frame. So what happens then if you do you wait until after that 25 time frame? What do we call that?
That's when it's acute. It's the most recent. That's typically if you haven't been checked anytime between like 0 and 25, and then you come in after that, we're pretty much going after the adjustments first for that acute range of 25 and older.
Yeah. And those are the subluxations that typically cause pain, right? Yeah. So, that's where, I bent over and picked up the empty laundry basket and I felt my low back, seize up. Or I just slept funny and now I woke up and I have this kink in my neck, or I slept on the couch, or, or my dog or cat slept between my legs. And it's like, or I was being a weekend warrior and I, where it was doing some lifting with dirt or raking too long or whatever. Yeah. And so you wake up the next day and it's like something just is locked up and you can't turn or you can't bend. Yeah. Those are the acute subluxations. And those are the type of subluxations that typically, the pain can resolve, within 80%, usually within a week or two, in most cases. But unfortunately, some of those subluxations have been there for, long periods of time. And it goes back to that that adolescent, pre-adolescent phase, that subacute and chronic phase that have been there. So we're always trying to determine when someone comes into the office, what phase of subluxation, are we seeing? Sometimes it's multiple, right? Because they've got it across multiple timelines. But and what are our goals to get that corrected, right? And I think having that understanding is very, very important. That depending on when things showed up in the spine, tells a story of, well, what are our goals? What are those specific subluxations causing right now? And is your goal just to get out of pain, or is your goal to really help correct and optimize the spine? Which, again, if you have subluxations that have been there for, a lifetime, it's a lot different conversation of trying to strengthen and stabilize the spine than just trying to correct what showed up, and get that kink out of the neck, right?
Yeah. Yeah. It also helps determine kind of our timeline of care for the patients. It's
absolutely,
we have a patient come in that's like 11 years old or 12 years old, we're adjusting them 1 or 2 times, seeing the, that chronic subluxation that they could potentially have, go away in 2 visits. Like, okay, we'll check you in a month, see how you're feeling. Yeah. Then you get to that 13 to 25. It's like, all right, that probably has been here for, a decade. Maybe we need to see you routinely for a couple of months and go from there. But then when you get to that 25 and above, say you have somebody comes in 45 years old, and you see a subluxation of the spine that you're like, all right, I think that's a chronic one. Yeah. That's not going to go away in 2 or 3 visits, 2 to 3 months. Yeah. You might feel better. Yeah. I think that's always, I feel like when they fill out that paperwork, they always nail it for when they're probably going to feel better. Yeah. But in terms of correcting the actual issue and preventing that pain or symptom from coming back, like that takes, years, so to speak, to kind of keep that corrected.
Yeah, and it takes time to strengthen, right? Like if you've never weightlifted before and you start weightlifting at 50, like you're not going to be squatting 400 pounds and benching 300 pounds inside of a couple months. Like, I mean, I guess it's possible, but like it's all about the strengthening, correction and ultimately long-term vision for your health and well-being. Again, our goal is to get the spine strengthened and stabilized as much as possible, and then figure figure out what's the best timeline to just keep the momentum moving forward of checking in. And sometimes people come in and they need very, very minimal, spinal tuning or, tune up. We like to call our adjustments tune ups, right?
Yeah.
So it's not about coming in and getting an adjustment because you're in pain, but it's about making sure that your instrument, your spinal instrument is as finely tuned as possible, so that it, impacts your neurological performance and just your overall ability to adapt and be healthy day to day. And some people, the frequency of when they come in and get checked is, every other week. Some people can go a month or two. And, some people just have a very high stress lifestyle, and they know they function better by getting checked and adjusted every week. So, really it comes down to the individual and what their goals are and what they want moving forward. And that's one of our core values in the office is that customization of care, because, everybody is different. And it really comes down to what is your spinal history? What phase of subluxation did you, get subluxated and, corrected, and really what are the goals, what's the vision for your health long term. So if this is new to you, maybe you're maybe you're a chiropractor, another health professional listening to this, maybe you have kids or grandkids that you're like, oh, should I get them checked? Like, I want to make sure that their spine is developing as healthfully as possible. Like, just having that conversation, feel free to reach out. We'll make sure we publish the link to the case study that we posted on our website. That'll be in the description section underneath, so that you can actually see that scoliosis change in one adjustment. But if you're not sure if chiropractic is right for you, again, we are very non-pushy in the office. We're just here to help those who truly want to get healthy and stay healthy, find the best path forward. So feel free to reach out. Catch us at the next one.
Yeah, absolutely.
Thanks for stopping by.
Yep, thanks.
You've been listening to another episode of What the Health? The podcast where anything health is fair game, with your hosts, Dr. Dan, Angela, and Dr. Riley. Brought to you by Chiro Family Chiropractic. If you'd like to learn more about some of the resources mentioned on this show, or you have questions about something that was discussed, please reach out through our website at www.chirofamilychiropractic.com. Remember to like and subscribe to What the Health Podcast to catch all the latest episodes and replay your favorites. Thank you for listening, and remember, we're always here to help when you find yourself saying, "What the hell?"